For decades, we have been told that heart muscle doesn't grow back. Once damaged, it is done. But today, we know better. The heart does have a limited ability to regenerate. And more importantly, we now understand how lifestyle, especially nutrition, can influence recovery after a heart attack or any form of heart damage. I'm Dr. Nony, I'm a physician, and today we're going to dive into what science really says about how your heart can heal, what's possible, and how your daily choices can directly affect that outcome. Stay tuned. Let's start with a patient I will call Mark. Mark is 59. He has hypertension, type 2 diabetes, and was about 40 pounds overweight. He came to the emergency room with chest pain. His EKG showed heart attack, anterior STEMI. He received a stent in one of his coronaries. After everything stabilized, we checked his ejection fraction. That's how well the heart is pumping blood. It was down to 30%. Normal is over 50%. He looked at me straight in the eye and asked, "Is there anything can I do besides medications to help my heart get stronger?" Well, that question stuck with me because more and more patients are asking the same exact thing. And the answer is yes, but it takes the right steps. So the question is heart damage permanent? If you're looking for a short answer, some of it is. When heart muscle dies, like during a heart attack, that specific area is replaced by scar tissue. Scar cannot contract like muscle, so that function is lost. But here's the part most people don't know. The heart is not completely static. Studies show that we do create new heart muscle cells, even as adults, just at a slow rate, about 1% a year when we are young, and less as we age. And beyond that, the remaining healthy muscle can strengthen, adapt, and take over some of the lost function. After a heart attack or injury, the heart goes through a process called remodeling. That means the shape and size of the heart may change. The muscle walls may thicken or thin. Scar tissue forms, and some areas may start to work harder than others. Remodeling can go two ways: positive remodeling, which is stronger heart, better function, or negative remodeling, which is heart failure, lower ejection fraction. What makes the difference? Well, number one is medication like beta blocker, ACE inhibitor, and SGLT2 inhibitors. Number two is controlling blood pressure, diabetes, and cholesterol, all the risk factors. And number three, and often overlooked, lifestyle, especially nutrition. While nutrition doesn't just affect weight, it affects the heart at a cellular level. Let me break this down. Number one, anti-inflammatory effects. A diet rich in fruits, vegetables, and whole grains, and healthy fats lowers inflammation, which helps limit further damage after an injury. Number two, improved blood flow. Foods high in antioxidants and plant compounds like berries, garlic, and leafy greens help the blood vessels dilate better. That means more oxygen reaches the heart muscle. Number three, less oxidative stress. High fiber, low processed diets reduce free radicals that can damage heart cells and lead to further scarring. And number four is lower workload for the heart. Losing weight, reducing salt, and managing blood sugar all decrease the heart's workload, helping it recover more easily. We now know that your gut health impacts your heart. Diet rich in red meat, egg yolks, and processed foods increase a compound called TMAO, which raises heart disease risk. Meanwhile, fiber from plants support gut bacteria that produce short-chain fatty acids. These reduce inflammation and help lower blood pressure. In other words, what you eat doesn't just feed you, it feeds your heart indirectly. Mark was motivated. Alongside his medications, he made real changes to his diet. He cut out processed meats and fried foods. He added a big salad with legumes every day. He switched to olive oil instead of butter. He ate berries and oats for breakfast. He started walking 25 minutes a day after dinner. 3 months later, we repeated an echocardiogram and his EF, ejection fraction, went from 30% up to 42%. His blood sugar and blood pressure improved. He lost 15 pounds and he felt better physically and emotionally. Did we regrow his lost heart muscle? The answer is no, but we improved his heart's efficiency, strength, and reserve, and that's a win. So here's what I want you to remember. The heart doesn't regrow large areas of muscle, but it can recover function. Medications are essential, but lifestyle, especially nutrition, determines the heart's environment for healing. Food is not just fuel, it is a biological signal. Every bite you eat either supports or restrains your heart. Here are 5 easy but powerful steps you can take starting today. Number 1, eat 2 servings of vegetables at both lunch and dinner. Number 2, replace red meat with fish, beans, or tofu at least 4 days a week. Number 3, swap sugary drinks for water or herbal tea. Number 4, have a fruit-based breakfast like oats and berries. And number 5, walk 20 to 30 minutes after your largest meal of the day. It doesn't have to be perfect, but progress matters, and your heart will notice. The heart is resilient. It may not be able to grow back exactly what's lost, but it can adapt, recover, and regain strength. I have seen it happen in patients, and I believe it can happen for you or for someone you care about. I'm Dr. Nony, and I make videos like this to help people understand their health and take action. If you found this helpful, please like this video, share it with someone you care about, and subscribe for more science-backed, heart-healthy content. The power to heal starts with what you do next. Thank you for watching. I will see you in the next one. Bye-bye.